Microbial resistance means that the antibiotics which were working earlier in infections are now not working. And this is because the organisms which cause the infections have grown resistant to these antibiotics because of use over a period of time. And if we want to prevent the development of antimicrobial resistance, we need to use the antibiotics very conservatively and judiciously. Antimicrobial resistance has nothing to do with the body of the person. It is because the organisms which the person is harboring have devised ways of becoming resistant to the antibiotic or of countering the antibiotic, because all species need to survive. Similarly, bacteria also over a period of time, having been exposed to the same antibiotics, have developed mechanisms of resistance. So the organisms causing the infection have become resistant to the antimicrobials. This is not correct, because even patients who do not consume the antimicrobials directly, they also can expose to antibiotics, because a person who takes the antibiotics somehow sheds these antibiotics in his body, and they find their way into the municipal sewage system or the water, and therefore people who have not consumed the antibiotic directly may be exposed to these same antibiotics indirectly. Therefore, this is a myth that patients who have not consumed the antibiotics cannot have the effects of antibiotic resistance. And also, certain food products and poultry are given antibiotics in the agricultural sector in order to cause their fattening, and therefore all individuals may consume antibiotics indirectly and must be aware of this fact. Whenever you prescribe an antibiotic, you must take it as per the direction of the physician. If he's told you to consume it for 5 days, you definitely need to complete the course. If you feel better by the end of day 2 and you stop the antibiotic, then the organisms which have caused the infection are exposed to the antibiotic, and they will devise newer methods of becoming resistant or escaping the effects of the antibiotics, and this will promote antimicrobial resistance. And therefore it is very important to complete the course of antibiotics as directed by a physician.